All right, I think we're going to go ahead and get started. Good afternoon, everyone. Thank you so much for joining us today. I'm going to go ahead and turn it over to TJ Ward, and we're going to learn a little bit today about certified facilitators and addiction awareness. So TJ, go ahead.
Hey there, everyone. TJ Ward, North Florida Director of Advocacy for Project Opioid. The voice you just heard is Abby Bell. She's our program manager. And I have the privilege of co-chairing the Employer Workforce Committee, along with Dr. Kelly Tice of Florida Blue and Guidewell. She's the Chief Health Equity Officer for that organization. And we get to work with the amazing team over at Drug Free Duval as well. So we're excited to bring you this Small Bites workshop here today. As Abby mentioned, we're talking about certified facilitators in addiction awareness. And really the purpose of the Employer Workforce Committee is to create prevention-minded and recovery supportive workplaces. And we feel like this is an important goal. You can see on the slide that we do this through creating policies or helping employers create policies, also educating and bringing awareness to the business community about this issue, facilitating trainings to help them in their setup with how they can take care of their employees, and then giving them free tools. One of them is what we're doing here today. So we're excited to be with you, and just really want us to think before we get into the interview video that we're going to show you. Just think about why we're here, why we're doing this. And so if we can go to the next slide. So this number may be familiar to some of you, 110,236. This is the CDC's predicted number of overdose deaths in the United States for March of 2021 to March of 2022. This is why we're doing this. This is the most important factor in relation to the work that we do in this area. Many of you are heavily involved in addressing the overdose crisis. Some of you are employers who've logged in to really learn a little bit more about how you can become involved in addressing this issue through your place of business. Whatever the case, we all need to be reminded about the fact that people are dying every single day of overdoses. And so there are some things that we can do that are practical, not only as those folks who work in this every single day, but even as business leaders, as employers, to really address this and help prevent these overdose deaths that are occurring. Another number I want to mention is 1.478 trillion, and that is definitely not a small number. That is a massive number. This is the amount of dollars the opioid crisis cost the United States in 2020 per the Congressional Joint Economic Committee. And so you can see there's not only an issue related to the loss of lives, but this is really impacting businesses and their desire to really do productive business while trying to help those who they employ. So these are just a couple of reasons why we're doing what we're doing through the Employer Workforce Committee, through the Employer Toolkit, through these webinars that we host on a periodic basis. And so we're glad that you've tuned in to learn a little bit more about this. One thing that I want to mention before we get into describing our guests here today is that Abby and I are actually in Putnam County. We're in Palatka today. And so we want to give a shout out to SMA Healthcare. We're actually facilitating this webinar from their drop-in center. They were gracious enough to provide us with Wi-Fi while we were working out here in Putnam County today. So we wanted to make sure that we shared that with you. If you hear some extra noises, it's because they've got a lot going on. They're doing some great work here in the drop-in center. We're excited to partner with them right here in Putnam County. So as we move forward, we're going to introduce you to one of my favorite people that's working in this space. Her name is Cheryl Brown Merriweather. She's the Executive Director of iCare. I'm going to read her bio to you. She's the co-founder, vice president, and executive director for the International Center for Addiction and Recovery Education, which is a nonprofit organization dedicated to solving the growing global problem of substance misuse and addiction. Cheryl is the immediate past president of the Greater Orlando Society for Human Resource Development. You probably know that as SHRM, and the Greater Orlando chapter is known as Go Sherm. And then something I thought was really cool, and I don't have time to read all of her bio. I think she'll get into some of that here in the video interview. But something I thought was cool was in 2022, Success Magazine named Cheryl a winner of their inaugural Women of Influence Awards for her pioneering work in addiction and recovery. So this is a lady who has tons of experience in this area and is doing great work, not only in her region, but across the entire country. She's now a sought after speaker that is doing tremendous things and has a lot of good information to share. She's being interviewed by our friend Susan Pittman from Drug Free Duval. And so we're going to go ahead to the interview and let you watch and learn from their conversation.
Good afternoon, Cheryl. It is so amazing to have you here with us today to talk to all of our business folks in the region on our Small Bites workshops. And we're really, really grateful that you joined us. And we're just going to dive right in because there's so much information and 30 minutes is going to be tough to fit it all in. So the first question that I have for you is, as a SHRM professional, what needs did you identify that led you to this solution, to this particular project you've undertaken?
Oh, thank you so much. That is a great question. So to kind of frame it, I have to give you a little bit of my unique perspective. I've had more than 30 years of experience as a manager in the workplace. I've worked more than 25 years in both management and human resources across a variety of different types of companies, nonprofit, for-profit, multiple industries. I've been an adult education practitioner in the workplace and at 2 universities. And then for the last 15 years, I've worked in addiction and recovery support. So, you know, addiction and substance misuse in the workplace, it's not a new thing. Alcohol is a drug, and that's a big part of workplace culture. But you know, current best practices of HR, well, they're primarily reactive. Typically, HR folks only engage around these issues when there's been a critical incident in the workplace, or when, sad to say, someone crashes and burns. But recently, things have changed, and we as HR practitioners, we are at the point where we have to make some changes. We are absolutely in uncharted territory. It kind of started back with the Me Too movement, George Floyd, the pandemic. And lately you're hearing things about the Great Resignation, quiet quitting. And I heard a new thing recently, they're calling bare minimum Mondays. All of that is a sign that people in the workplace are in great distress. And as a result of that, what are they doing? Well, they're seeking relief. So all the data show that mental health issues are off the chart, as is the use of substances. So you can translate that to say that people are suffering and they're self-medicating. And then, oh, let's not forget legalization of marijuana, right? Cannabis is now legal for recreational use in something like 21 states and medicinal use in 39 states. And now magic mushrooms and other psychedelic drugs are being explored as viable forms of treatment in, you know, mental health. And fentanyl, every time you turn on the news, fentanyl, which is a synthetic opioid, is destroying lives. And these issues cross all socioeconomic and all types of demographic groups. So again, these are workplace issues. And so that's one of the main reasons why I had the opportunity to be a spokesperson for these issues, encouraging the workplace to make some changes in their current practices, shifting from a more reactive response to a more proactive and preventative way of engaging around these issues in the workplace. Real quick, and I'll just touch on one thing. Last year, I saw 2 letters that were written by the American Hospital Association to the leaders of both houses in Congress at the federal level. And they clearly say there are not enough, number one, healthcare providers, period, in the system of care, but they emphasized that there's not enough mental health or behavioral health care providers. So folks getting in that
Critical.
system don't have enough support. So we are working to shift the focus to prevention. And the main element of prevention is awareness. Awareness comes through education, and that's what this program provides, a way for the workplace to begin to engage around awareness and prevention through education. And we are so excited to be able to talk about that with you today.
Well, you are completely speaking my language. You know that as the director or as the founder of Drug Free Duval, which is the Substance Abuse Prevention Coalition here in this region, we are so grateful that you are embracing prevention, that you see the wisdom and really the cost savings and the life savings of being proactive versus reactive. And when you helped us understand the programs that you're offering, it's amazing. Can you describe the two tracks of program that you currently have developed and are so successfully implementing?
Yes, I can. And I'll, again, to help frame how it came about, our institute, iCare, has trained and certified clinical professionals for more than 25 years. And then about 10 years ago, we started training non-clinical recovery coaches. And it was a suggestion on the part of those coaches, many of whom come from professional workplace professions. I mean, I've got nurses and I've got airline pilots, and these folks have gone through their personal recovery journey. And they asked us to give them the tools to go back into the workplace and in some cases into communities with an education program that would help to raise awareness and break the stigma and create safety around these conversations. So we were already doing that, developing a 14-hour blended learning program that led to facilitators becoming credentialed as certified facilitators in addiction awareness. And then we had the opportunity as a result of the partnership between Project Opioid and Career Source Central Florida, which is our workforce board here in Central Florida, and Go SHRM, the Greater Orlando Society for Human Resource Management. We all saw the need, and there was some funding provided to provide training to HR practitioners around typically the opioid epidemic, but more. And that is what opened the door for us to expand the 14-hour training to an addition of 6 more hours of training. So now what we have is a 20-hour blended learning program that leads to either a certificate of completion or a credential, a certified facilitator in addiction awareness for human resource practitioners. Again, it's blended learning program. There's self-directed content and interspersed with live meetings that are led by world-class facilitators who bring the participants together to discuss these issues, and they learn to actually themselves go back into their workplace and create that same psychological safety that facilitates conversations around this topic. So the individuals who just go through it as a learning experience come away with a 20-hour recertification credit with SHRM. So if they are SHRM certified, they get that 20 hours of recertification credit for completing the program, which does spread out comfortably over about a 9-week period of time. But then for folks folks who really want to take that learning back to the workplace. And as a result of the learning, they not only can do lunch and learns, for example, either live or online, but they can customize the program to deliver management training or other activities within their workplace. So they can customize it based upon their industry, or they can customize it depending upon the audience or the amount of time. Those are the skills that they learn. We provide them with all of the materials, and they come away with, those folks, a credential, a certified facilitator in human resources, credential CFAA-HR are the letters, but they must also introduce a plan that ensures the program is sustainable. The worst thing we could do
Brilliant.
would be something that comes and goes. It's the flavor of the month. That's not what this is. This program is designed to give the facilitator the tools to create lasting workplace culture change, which benefits the organization and impacts the organization's bottom line in so many ways. That's why we're so excited about the program. And to date, we've trained more than 150 folks have gone through the program. Started here in Central Florida. It is now been looked at, and participants have joined and gone through the program from all over the United States, and now it's expanding to other countries. The U.S. Department of Labor is looking at it. So it's the kind of thing we want to make available to folks in North Florida as well.
Well, this is incredibly exciting. And I just, I have so many thoughts, because the way that you can create industry specifics, because there are differences in industries in terms of typical drug or alcohol usage. There are differences in cultures and things like that. So the flexibility is phenomenal. The idea that it's over a 9-week period, and that there's the 2 different tracks. So if I, as an employer, don't have an HR professional, then perhaps I choose the 14-hour course for my staff person to go through. And if I do have a more robust staff, maybe I do both. Send a few people through both just the facilitator side and the certification process. I mean, it's absolutely brilliant. And I as a person who loves data and stats, I've really researched that the number one reason that employees report that they use substances while on the job is stress. Yes. And it sounds to me like so much of your program helps the facilitators and the HR professionals to learn how to maybe change the culture and reduce stress. Is that a benefit that you've seen?
Oh, absolutely. And you said it. It's not a one-size-fits-all program. There are drug-free workplaces, as you know. There's this sober, curious movement that's spreading around the country. Think of Dry January, Sober October. Those are folks that are just curious about a different lifestyle choices, perhaps just for personal well-being. There's recovery supportive, recovery ready, recovery friendly workplaces. Participants in this program learn about all of these, and they have the opportunity to pick and choose what fits best for them as a starting point. And then over time, they can grow and try new things, but it gives them a place and a firm foundation upon which to begin this journey.
That's fantastic. And so give us a success story or two, something that you've seen where somebody's gone through the program and perhaps really made a difference in their company and culture.
Well, the success stories are many, too numerous for me to share with us in the time that we have today. But one of the amazing, I call it a silver lining in the terrible pandemic story that we've all gone through, is that it has brought about incredible collaborations between individuals and groups that are already supporting the workplace. So for example, we have had quite a few coaches come through our program, become facilitators who came from health and wellness backgrounds. So if you think about the National Wellness Institute, the National Board of Health and Wellness Coaches, even NAMI, for example, have all approached us and sent individuals to us to go through our programs to then take back into their workplace or their communities and provide support for these initiatives. So one of our it began as a certified professional recovery coach, is a manager at Oracle, and she was on her personal recovery journey, and she wanted to become a recovery coach to sustain her own recovery and help others. She then went beyond the coaching to the facilitator program that we're talking about here today. She took the facilitator program back to Oracle and formed an affinity group around wellness, which incorporated a lot of the things that she had learned about substance use disorder and behavioral health in general, working through and navigating her own recovery journey. The week that she started it in Oracle, and they did it virtually using Slack, a Slack channel, she had 400 employees who would otherwise hidden or covered came out of the woodworks to join this group. It was so successful. Her insurance company providers asked her to begin to do presentations for the benefit of other members that were utilizing their benefit programs. So it was, again, so successful that the diversity, equity, and inclusion folks inside of Oracle formalized an affinity group that began with one facilitator taking the initiative as a champion for these issues inside of her organization, just by being willing to share her story. 400 other individuals came to be a part of that group that has now grown to become an established and formal affinity group inside of Oracle. Real quickly, we were contacted by a gentleman at Wayfair. He has successfully formed an affinity group called Way Sober inside of Wayfair. And the most notable one of all is Salesforce has started a group, an affinity group called Sober Force. So we have had small plumbing companies. We have individuals from hospitality hotels here in Central Florida. We've got hospital folks coming through the program. So it is a viable program, and the success stories, again, continue to grow. So next time I come, I believe I'll have even more that I can share with you.
I bet you will. Is there any opportunity for a couple of companies to band together, perhaps like small businesses? You know, are you flexible enough to work groups like that? If we have 2 or 3 very small companies, they want to train maybe 2 individuals and split the cost. Is that something that your organization would be willing to consider?
Absolutely. Our organization, iCare, the International Center for Addiction and Recovery Education, is a 501c3 nonprofit organization. So we are mission focused. And so therefore we are more concerned with doing this work and helping others to do this work. Yes, we have to keep the lights on around here, but we will absolutely wheel and deal and provide discounts and work some packages out for folks. We'll do whatever is comfortable for the organization. We can offer some payment plans, but we want to get this out there in the hands of those allies, those champions, those peers. Peers are folks who have lived experience, and they want to take the ball and run with this. All they need is leadership support. If the leader gives the green light, and sometimes they have their own recovery journey or lived experience with a family member or other professional colleague that they have a relationship with or experience with, If the green light is given from leaders, then it opens the door for these champions to come, and we will work with them to make it accessible to them so that they can implement this as soon as possible. And we have another program starting, by the way, in July, and we can share the dates with folks around that session. And if July is too early, we'll finish the year with another session in October. We try to do about 3 a year. There's one running now, but just have folks reach out and contact me, and we'll see what we can do to support them to accomplish their goals.
Thank you so much, Cheryl. I do want to put one final, I didn't tell you I was going to ask you this question, but you recently got an award.
Yes.
And a national award, right? So I would like you to share a little bit with everybody about that award and why you got it, why your group got it.
Okay, so it was the SHRM National. SHRM National is the premier organization for HR practitioners nationwide, actually globally. And it was the partnership, the collaboration between Project Opioid, the Career Source Central Florida, Go SHRM, the Greater Orlando SHRM, and I Care, my organization. We partnered together to create this program, and it received not only the SHRM National Award, but of course, it won this HR Florida Award as well. But it was because this is such a vitally important issue in the workplace. You know, again, the prevention side of, or the treatment side of house just does not have the resources needed to accommodate and support the dire state that we find ourselves in. So this program is customized for HR practitioners to allow them to have the tools, resources that they need to impact their workplace and their employees around these issues. And it has been phenomenally successful. SHRM granted us the Pinnacle Award. Go SHRM is 65 years old. It was the first time in our 65-year history that we won the Pinnacle. Thank you for allowing me to share that, but it has put in place momentum for many other very wonderful things to happen as a result. As I mentioned, we're partnering with NAMI, the mental health folks, and they hope to piggyback on that and customize a version of this program for the NAMI members as well. So we're hitting workplaces and communities around this issue. And thank you again for allowing me to talk about it today with your members.
Absolutely. Well, I want to close by saying our group is familiar with the employer toolkit that we have been promoting here in this region. And one of the key stops on our employer toolkit, one of the goals that we would have for our employers to really achieve the kind of cultural shift in their workplaces and to create the healthy working environment that we're all looking for is to participate in your program so that they can literally be game changers in their companies, in their communities, in their homes, etc. So we are deeply appreciative of the work that you're doing and so excited. I want to see hopefully at least 10 people from North Florida end up participating in your program over this next 6 months and then maybe next year 25. So we really, really appreciate what you're doing. You are putting legs and standards and quantified processes around how we take this into the workplace. We do some good training and good information and education, but your training is really top notch, and we're very, very appreciative and just can't wait for people to reach out to you and call you. And we hope that you get lots of traction from this Small Bite Workshop.
Well, thank you so much. Send me information on your toolkit, because as part of the program, we include supplemental materials that folks can reach out and access within their own local community. And I have several toolkits in there from other states, but I would love to include one that you've created for folks that are here in Florida. So please send it to me. We'll get it included in the package, and we'll just help promote what you're doing as well. So it would be my pleasure and our honor to do that.
Well, thank you, Cheryl. We just appreciate you so much. And we're grateful that you're here in our state and that this is going all over the rest of the United States too. And Everybody, if you want to get in touch with Cheryl, your info that will be on our next slide. You'll see Cheryl's contact information. Thank you. Thank you for being such a change maker in our state.
Thank you for having me today.
Take care.
Bye.
Thanks so much to Susan and Cheryl for that incredible interview. If you want some more information about the programs that Cheryl was talking about, you see her contact information right there. Also, if you would rather us connect you to Cheryl, I think Abby has put her email address in the chat, so you can copy that down and shoot us an email. We're happy to introduce you to Cheryl. Hope you found this information helpful and that you'll take advantage of the opportunity. We would love to see more and more people go through this training so that they can be an effective part of creating prevention-minded and recovery supportive workplaces here in Jacksonville and across North Florida. Our next Small Bites workshop is coming up in July on the 11th. It'll be at 12 p.m. You can shoot the QR code there to sign up. We would love to have you there as a part of this ongoing offering with these Small Bite workshops. Hope you're enjoying these, finding these helpful to you. Also, just want to say thank you so much for carving out some time in your schedule today. We greatly appreciate your willingness to be a part of what we're doing and what we're offering, and want to continue to partner with you so that we can address this issue in North Florida and create opportunities for people to get well. We just are grateful for the collaboration that's taking place here through this. So we hope you have a great rest of your week, and we will see you on July the 11th at 12 p.m. Thanks, everyone.